the President of the Sri Lanka Medical Association. Very good evening to you, Dr. Gunaratne.
Good evening.
Dr. Gunaratne, are you satisfied with Sri Lanka's progress in the fight against COVID-19? Lockdowns, vaccination drive, whatever. Are you satisfied?
That's a sort of a fairly vast question to be answered by yes or no,
Right.
because there are so many components of this management, and there are so much of complexities involved. So I think that it's unfair for us to say yes or no. There are many areas that we could say yes, but at the same time, there are areas that one could not be happy.
What could be the areas that need re-looking at or working at?
Actually, with regard to the mitigation process itself, now if you take the mitigation, initially we had to implement wearing masks, social distancing, and we all, you, me, and all together, we all tried our best to communicate that message to public, but then there were problems with regard to adherence, and then we had to face two severe waves. The third, I would say that third wave itself has two components, and in both these, there was a delay in declaring lockdowns, so that there was increased number of cases. So that at least now, at this point of time, we could be happy that we are in a phase that the numbers are going down. Say, if you think of the last week comparing with the one before the last, there had been 37% reduction of cases, and has been a 12% reduction of deaths. So that's a place that we all could be happy at this point of time. So it's a matter of that we very meticulously and scientifically taking it further forward to see that we get the hold of the control.
And what's your take on the lockdown? It's not really a properly implemented lockdown. There's a certain amount of leeway now. But what's your take? What's the medical take on it?
As you say, that this is not a proper lockdown, because all Sri Lankans know that what a proper lockdown. It's because, initially we all were there in a proper lockdown. So since then, I don't think that much later we ever had a proper lockdown. Every time it was a lockdown with leaks. So, but then, when it is for a longer period, it becomes difficult for us ourselves to understand that how much stringent the lockdown could be. So there are areas that one needs to sort of really be stringent, and there are areas at the same time that one generally could consider relaxed. So based on how stringent the lockdown is, that the quicker that we would see the results or the outcome. So based on that, how much relaxed the lockdown now is, that there would be a delay to see the outcome. So that's what we have to understand at this point of time. We are happy that there are areas that we would be we are very seriously be concerned, like say public transport, opening the restaurants, bars, so on. And at least those places that where you may see that increased transmission at the moment is closed. So you see that there is a reduction of cases, but then as the lockdown is not perfect, we will take a longer period to reach the desired outcome.
Isn't the real issue here as to where to find the mix between what the pure medical point of view and the need for us to have our economy functioning in some way, because obviously 62% of our working population are daily waged. So where do you find the mix between the health requirements and the economic requirements?
There is no set accepted mix as such for us, because the various countries adopted varying techniques. We just do not know which country is wrong and which country is correct, because it depends on the number of people in the community as well as how affluent the country is. So this is what we adopted, and we see that weaknesses of many deficiencies of what we adopted. There are many areas that we would have done better. So it's not possible for us to say that. I mean, we 100% could say that if you do this, this would be the outcome, and if we do not do that, this would be the outcome. That we as health professionals are very confident in spelling out. But beyond that, we will understand that there are many other necessities for our country. So we have to accept certain other decisions that are being made.
And Doctor, when you study the figures that you see now, where we have the increased number of vaccinations on the one hand, and the figures apparently coming down, if you study the trend, how much longer should we be in this semi-lockdown state?
As it is, we still are at high risk category because even in today's context, you would see that we report more than 2,000 cases per day, and we have about 150 deaths per day. So as at present, still as a country that we are at high risk, and also the health network or the health institutions have the risk of being overwhelmed with the capacity that they could accommodate. So I think that we still have, so much time that now our last decision was made on around 10th, I think. So we need to wait until 21st or 20th to see what the situation is before we make the decision. But then it's clear for us, but by 21st, we would not become out of risk. So if we could further extend at least as it is, the curfew, then we would gain more. So and at least that until we reach about 900 cases per day, if we could move forward in that way, I think that we would be in a better position to have a better outcome for the country.
And Dr. Padma Gunaratne, are you satisfied with the COVID patient treatment mechanism at home? Because we hear, we see, we read that there are several cases of people dying at home.
It's not any place that, anything that one could be happy, because about 20% of our patients either die at home or die while reaching the hospital, on the way to hospitals. So it is not anything accepted, because particularly in our setting in Sri Lanka, when you compare with other countries in the region, we were far ahead of others with regard to the health care, in this region. So in that type of a setting, I don't think that it is acceptable for us to see that about 20% of our patients either die at home or die on the way to hospital. But then when you compare with what would have happened, say if we went on as it was, if we did not declare the curfew at least on 20th of August, then the hospitals really would have been overwhelmed, and we would have exceeded the capacity that they could accommodate in hospitals, and that would have created chaos. So there were many areas that we could improve. One was to establish this home care system, and the other was that even from the Sri Lanka Medical Association, we could open up a helpline for patients, 247, so that we provide the advocacy or advice that is needed for patients. And tend to select that who would need hospital care, and then who could be managed at home setting. So by both these processes, that we were able to greatly reduce the number of admissions to hospitals, and by that only the severe patients who would need hospital care and who would need ICU care were directed to hospital. So that those two processes were actually was an asset, was so useful to manage hospital settings in the country.
I just want to move slightly to the side here. I want to ask you this. This question been posed to me by members of the public previously, and that is this. When we look at Sri Lanka's plantation sector and the use of line houses for accommodation and so on, do we have any reports that the incidence of positive cases are greater in those communities because they tend to all 2 or 3 generations live together in the one line room, for example?
I am very much with you with regard to this subject because it was recently that I saw many of these patients are from this estate sector, and I think that there was no one to make a voice for them. I feel very bad because that is an area that had been neglected, and I think that they need attention.
Indeed, and News First, of course, is always there to be the voice of the voiceless. So News First will do what we can to highlight this problem, and by no means have these people been forgotten, our fellow citizens who live in line rooms and so on. We haven't forgotten them, but we do want legislators to answer questions as to what sort of return on investment these plantation workers get from their 5 rupees per day that they are obliged to give them. So that's a separate topic for a separate day. I don't mean to bring Dr. Padma Gunaratne into this into that discussion, but Dr. Gunaratne, what can the public do to do better to control the spread of this dreaded disease?
So actually, when the country now next is open up, that actually will have to be done in a phased manner. So that's the time that the public will have to, I mean, even at present that they need to say that they adhere to the laid down restrictions for the lockdown so that they contribute in the best of their abilities to bring or to mitigate the outbreak to the extent that we can. And then when we open up the country, again, it's important that we understand that we should not think that we can get back to our normal life, and we still will have to continue with the face mask and all the public health measures that are needed to limit or to restrict the transmission of infection from one to one, from one individual to another, and it will have to be a sort of a long-term process. So by adhering to these public health measures and by taking all steps that you do not contract the disease, know that you let another, I mean, you do not spread the disease from you to another, and those by taking all maximum measures to adhere to those objectives, I think public would do the best for their country. I think that is what is needed from people at this point of time.
So just ahead of a break, let me just put this to you. If you really are patriotic and if you really do think about your fellow man, then you must be constantly aware of the health guidelines, the mask, the cleanliness, washing your hands and so on, and maintaining your distance. When we come back after the break, I'll be asking Dr. Padma Gunaratne this other question, which I know is on your mind, and it is this, that although some people take all the precautions that they can, they still, nevertheless, contract this dreaded disease. We'll see you on the other side of the break.
Newsline with Faraz Shaukut.
And welcome back to Newsline Zoom. I'm in conversation with the President of the Sri Lanka Medical Association, Dr. Padma Gunaratne. Dr. Gunaratne, thank you again for being on Newsline Zoom. I'd like to ask you this. There are 3 different things that I want to ask you. Let me start with the school children. What should we be doing? What about their vaccination? Should schools be open? I think kids are going completely nuts staying at home and putting up with the parents and the grandparents and the domestic help and all that sort of thing. So, you know, what should we do about the children? Should the schools be reopened?
Now, actually, this is an area that needs so much of attention because the children already have been at home for more than a year, and they have missed the school, the lot of activities that we do together at school. Education is disturbed, so definitely we are at a time that we should start planning. I think that very correctly the government has taken certain steps, and whether we should vaccinate them or not is a sort of a complex issue, because the scientific evidence for vaccination of children is little scarce. The beneficial evidence, I mean, the many scientific evidence have failed to show much of benefits of children getting vaccinated. I mean, they have looked into see that whether when the disease is under control, when public health measures are implemented in the community as well as among children, whether by starting schools, whether children would increase spread from school children to the household members, or whether children would increase spread of infection from children to children, or whether children would increase spread of infection from children to teachers and the other members in the staff and so on. None of these areas have shown any benefits or any increased transmission from children to any of these categories. So therefore, the benefits of vaccination of children is not that much impressive. So therefore, there is so much of controversy and discussion. And I think that the College of Pediatricians here in Sri Lanka are taking this subject seriously, and they are on the process of making decisions. So hopefully that they would make the decision for us whether our children need to be vaccinated or not over the next week, I suppose. So that's a decision that the academics will have to make, and once that is done, and there will have to be so much of planning to open up schools in a phased manner. So they need to be open, because say if you take Sri Lanka, not like the developed countries, the infections are not anything new to Sri Lanka. We have gone through many infections for decades. We have had cholera in the past, and then smallpox, then malaria, dengue, and long ago we had very high death rates for dengue. But now it's about 0.%, you see. So the management is so good that we hardly see any dengue child dying nowadays. So these infections are not anything new. Probably with health, the commitment of the health network, I mean, which is sort of spread so well countrywide. Definitely we should get the infection under control, and we should be able to open up our schools in near future.
And talking about schools, listen up, school kids. I know your parents are probably watching this program, and you might be hearing us in the background. But if you do, the 1st of October is International Children's Day, and Newsline Zoom hopes to do a program. And so we're looking for children to send us a little text and say, yep, I'd like to take part in the program with Uncle Faraz. And the number, of course, to send the message is 0772 300 305. 0772 300 305. And Shahan Ranatunga will get back in touch with you to arrange the event. Now then, Dr. Gunaratne, I wanted to ask you, what about this talk? There's social media chatter that we may all, the world may all need to have regular booster injections, rather like the flu jab.
There are many things, because this COVID is a new virus. There are many things that still are not known. So there are many things that yet to be determined. But one thing for sure is that all these vaccines, I mean, the effectivity of vaccines tend to wane. So therefore, that say if you take Israel that was vaccinated, the whole population was vaccinated with Pfizer, had to go for a third dose. Now, if you take third dose and booster, they are slightly different. The third dose you give as an extra dose, and the booster is given when the immunity tends to wane to boost up the immunity. So now there are instances that we recommend third doses, and also there are instances that we recommend boosters. So boosters definitely will have to come when the immunity tends to wane. So for all the categories, maybe from 6 months onwards, that one will have to consider of giving a booster, I think.
And finally, Dr. Gunaratne, what about how do we handle this once we have reached our the end of our vaccination drive? So in effect, the post-vaccination era, if you like, what should we be doing then?
There will be a lot of things that one need to plan, and there is nothing called post-vaccination era, I suppose, while the vaccination is being continued, while maybe that about 60% of our population have had about 2 doses, then we will have to plan for opening the country again in a phased manner, and not immediately all at once. And one first will have to consider opening the less risk areas. We know that, I mean, if we have not had much of discussions with regard to universities at any level, I think. So we have to consider opening up schools, then we have to consider opening up universities, and then to consider opening up the hotel sector, tourism. So there are many areas. I mean, they all will have their own specific issues that they all will have to be, I mean, sorted out, or all needs attention and sorting out based on the significance or the intensity of involvement. And so each and every area will have to be taken separately and will have to be planned to be open up and to again to get back to our normal life as the way that one would expect to live. So there are so many things that one needs to pay attention, and everything will have to be done in a phased manner.
I want to ask you this, Dr. Gunaratne. You know, when we look at, we're in lockdown now, partly imposed or partly implemented, whatever, we're in a lockdown. Now, when I went past a economic zone, I think it was Paliguda, the way it's all designed, there's so many people, the crowds are incredible. And these are people from the trade. So there are people bringing the produce in from the various farmers and so on, but they're all congregating in this one place. And then there are others who come and buy those things and take it away. Ostensibly, they could be taking away the dreaded disease as well. They could be taking COVID with them. How does one get around this, and how does one control this?
If there is congregation of people, definitely that would be a source for a cluster. Definitely, that would be a source for a cluster. But at the same time, I mean, the severity of the cluster that would happen, I do not know whether it would be to the same extent the way that we used to have 2 years ago, when a very few numbers were vaccinated. Now the cluster, the severity of the cluster that you and I would see is unlikely to be as severe as the way that we used to see 2 years ago. And also, if it's in an open area, now say if the same congregation was there in a closed up, cramped up place with where there isn't much of ventilation, then the severity would have been much worse than being in an open area. So, I mean, you may have seen that by this time, our guidelines also indicates that sometimes the people working in work sites could be allowed to work, because in areas that there is good ventilation, there is lesser risk than working in a closed-up place. So there are problems, issues, as well as there are benefits, because that these are long-term processes that we are sort of implementing. There are certain issues that one will have to sort of become helpless when looking at. So I think that if this was not there, then we would have opened up the country much earlier with a lesser number of cases. But then there are certain things that you and I do not know how much that would contribute to, so that finally at the end, the outcome would be that we will have to be sort of with limited mobility restrictions for a longer period.
Right. Well, I suppose the good thing about these economic centers in that case is that the one I was talking about in Paliguda is, of course, it's very open. and there's plenty of fresh air because it's all open. In the meantime, we need to also acknowledge the fact that you, our viewers, tend to drive this program and the subjects that we discuss. For example, today, thanks to Auntie Josephine, we are discussing this tonight. So, thank you. Do keep in touch with us, 0772 300 305. We are not averse to anything. We'd love to hear from you all the time. Send us your questions, send us your sort of suggestions as to who we should bring on the program. Now, I'd like to go back to Dr. Padma Gunaratne and say to you, in between all this, we're doing what we can do, and so on, in terms of masking, washing, distance, and all that. But there are still people dying at home. What can we do?
This is a very important question, particularly in today's context. We see that the many cases happening in peripheries or the outstation, I would say, that the facilities may not be as better as one would expect them, what we see in Colombo. What we could do is mainly the public education for people to be aware of the symptoms and signs of the disease, what COVID-19, and that it is a respiratory tract infection, that it causes fever, sore throat, and aches and pains, joint pain, and maybe diarrhea, and say for people to have high degree of suspicion, and then for them to be aware that it does affect your respiratory system, and the worst is the difficulty in breathing. So one should, say, particularly because that we tend to monitor them at home, that it's important that they become registered with the medical officer of health in MOH in the region, so that they get to enroll themselves to a system that is being monitored by the Ministry of Health. If in case that if they haven't done any of those, the worst symptom is the difficulty in breathing. So it's very important that people are aware that they do not wait at home until last moment, because doctors need time. Once they have reached hospital, we need time for us to assess the patient, find facilities to patient, find oxygen and machines and so on, so that they have to give that plenty of time that is needed for hospitals to provide that treatment that is needed. So they have to reach hospitals well in advance. So that knowledge, you disseminating that knowledge to our people, only with going down the deaths that happen at home and on the way to hospital.
Doctors take a long time to qualify, and doctors know what they're doing. Don't forget to call them. Call them as soon as you need to. Don't give up on that bit. Final question, Dr. Gunaratne. Sputnik, 120,000 people got dose 1. There is no dose 2. What on earth are these 120,000 people supposed to do?
Again, an important question that we address our recent guideline or recent recommendations from the Sri Lanka Medical Association. But then much later, I saw that the State Minister of Health was, he stated that the Sputnik 5, the second dose, would be available by October for people. So if in case that if it's not available, our recommendation from the association had been to give them either the AstraZeneca, Pfizer or Moderna as the second dose. So that is what the recommendation of the Sri Lanka Medical Association had been. They need something. Then we know that the second dose need to be given.
So they're not forgotten at all then?
Oh, no, not at all.
Excellent. Well, on that note, Dr. Padma Gunaratne, thank you very much for being on our program, and your consultations, your advisories have, I'm sure, gone down well with our public, with all the aunties and the uncles, Auntie Josephines and everybody else, the uncles from all over the world actually. Thank you, and do send us your questions. It'll be a pleasure to try and get experts like Dr. Padma Gunaratne to address these issues. Thank you, and that's the way it was on Newsline today. Take care, and as always, God bless you.
News First Newsline with